what I just came to discover quite quickly was that my father, he wasn't really too aware at all about the 1 in 4 as a statistic in
Mhm.
itself. And he wasn't also aware that like prostate cancer is the second most common reason for death amongst men in general.
Right.
What if one simple test could save your life, but no one ever told you to take it? In the UK, black men are up to 1 in 4 times more likely to be diagnosed with prostate cancer. Yet so many still find out too late.
I said, you know what? Let me just create a bit of a buzz in terms of on social media where I could just talk to other people, and then also just go to the barber shops when I'm at and doing my thing at a time to just speak amongst the topic amongst the men of the community. And then what happened was came across the again more research of Prostate Cancer UK and realized that they offer volunteering opportunities.
Mm-hmm.
Today's guest, Jay, didn't just learn this statistic, he acted on it. After hearing about prostate cancer through Prostate Cancer UK, he encouraged his own dad to take the PSA test. And that early test helped catch a problem before it became something much worse.
But if it wasn't for that conversation that you had with your dad, it probably would have led to something more serious.
Yeah, I think it's definitely very important, but I think it again is one part of the solution. I think education and awareness is even more important for us as a people initially, because it's also promoting the right attitude and mindset to even approach this in general. That makes sense.
Yeah.
Because some man don't know, especially like what's the actual age you start off from doing checks,
Mm-hmm.
which we and you would know is 45. But
Now, Jay is a dedicated advocate, working with Prostate Cancer UK to make sure black men over 40 don't wait, don't guess, and don't stay silent. This is the Ivy Cancer Podcast, and this conversation could save your life.
The birth of this podcast is deeply personal. I've poured out countless hours into finding the right guests, shaping each conversation, and crafting every episode with intention. My drive comes from a live experience, from pain, resilience, and a desire to make a difference. By subscribing, you're not just supporting a podcast, you're helping grow a community, built on healing, honesty, and real impact. Thank you for being here. Now, let's get into the episode. Thank you.
Jay, welcome
Yes.
to the Ivy Cancer Podcast. It's nice to have you. Thank you for taking the time out to share some insightful information about your story, your personal contact with prostate cancer, and we will be learning a lot in this podcast. Steps to really navigate through these things with your personal experience, and you are also a cancer advocate. Before we start the podcast, originally, I like to start with a word of prayer. All right, let's just pray. O most righteous and eternal Father, as we gather here once again with another podcast, as Jay come to share his story to us, we ask that you may give us the insight, information that we need, and help us to navigate through this podcast. Bless the viewers and listeners as they join in your name we pray. Amen.
Amen. Peace and blessings.
All right, Jay, who are you and what led you to become a prostate cancer advocate?
Okay, so first I'll start off with just saying that. So thank you for inviting me to your wonderful podcast, Ivy Cancer. And my journey started from employment, whereby Prostate Cancer UK came into my organization and did a initial presentation to the workforce to just let them know in terms of the impact on men, which at the time was 1 in 8. But then they were also discussing around the statistics about the 1 in 4 that impact black men. And this kind of struck a nerve because I was trying to understand how no one's ever spoken to me about this, and I never knew about them statistics. But then also to understand like how severe this impact is within the community. So from that initial kind of awareness talk that they did, I kind of said, no, let me go do my own research to just look into this to just see, how much people know about this particular topic within the community
Mhm.
amongst my peers at the time, and then also just amongst my relatives in terms of my father, and then just seeing, what his thoughts was on that. Yeah, if he's spoken to anybody in our him generation.
Mhm.
And then what I just came to discover quite quickly was that my father, he wasn't really too aware at all about the 1 in 4 as a statistic in
Mhm.
itself. And he wasn't also aware that like prostate cancer is the second most common reason for death amongst men in general.
Right.
So when we kind of realized them statistics, and I said to him, you know what they said to me from the initial talk was just go get yourself checked out,
Mhm.
especially if you're over the age of 45,
Mhm.
which my father was at the time. And this was around 2018.
Mhm.
But when I initially heard about the awareness talk, that was in 2017. So I did leave you a bit of time to lapse because, life just gets the best of us. And
Right.
yeah, we're just talking. And then it was also trying to get him to persuade him because as a man, we have a certain level of pride. And then as a culture as well, we have different ways of dealing with certain things in terms of maybe we speak on a spiritual level or we
Definitely.
speak about it on a herbal level as well in terms
Mhm.
of the natural elements. So I said, all is good and true. However, sometimes you just have to look at things from a different perspective,
Yeah.
regardless of what we know, because we're from a place now where you need to just learn and have an open mind to all sorts of ways of thinking,
Mhm.
which it took some time to get him around. But in the end, what happened was I just booked the appointment for him, to be quite frank.
Okay.
And then he went in to do his test, which was a blood test at that time. And then they initially just came back and said that he's at stage 1 at the moment, but it could be progressing to stage 2 because the prostate is slowly growing.
Mhm.
So they did some further examination and consultation and etc. with him, and then he was able to come on a managed plan whereby he just had to make sure he's doing his regular blood tests, but then also just take medication,
Right.
which was definitely a good thing to know. So obviously that was a good but a bad scenario because to find out that your father, so what the statistics and what information you had presented was something that impacted me directly, just that initial stage. I said, let me go and see now, like, so what is the worst case scenario and what other stages are there in this process.
Mhm.
So then they start to talk about like stages 3 and 4. Now this is now where prostate cancer is more aggressive and you're doing more later stages of treatment, if that makes sense.
Right.
And then when I started to realize, like, you know, how it impacts your quality of life and that the side effects of certain treatments and all of them things that go on, I said, wow, no, this is a big thing. And then when I realized the impact on how many black men didn't realize now the community at the time, I said, no, this needs some action and like what can I do to improve this? And I had a really good kind of network as well within the black community, just in general in terms of my influence in the community because I
Mhm.
also do some like active engagement, community engagement activities like within schools and the education system. I
Mhm.
said, you know what, let me just create a bit of a buzz in terms of on social media where I could just talk to other people and then also just go to the barber shops when I'm at and doing my thing at a time to just speak amongst the topic amongst the men in the community. And then what happened was came across the again more research of Prostate Cancer UK and realized that they offer volunteering opportunities.
Mhm.
And then since then, yeah, I've just been a Dr. Water and just been getting more and more involved in other projects that they run each year. And then my first initial volunteer experience I had with them was with March for Men. And that was just basically just a initial awareness event in terms of raising money for the charity for obviously to do the research purposes, but then also just to promote the awareness amongst the community. And what I did like from that initial experience was there weren't hardly any black men at that event when I went at all at that time.
Mhm.
So it was just good to be a representation from that perspective. Took a few pictures and then started to promote all of my pictures them on social media. And then yeah, then the buzz started to just create and then pick up from there. And then 4 or 5 years later, doing a lot more campaigns, them starting to create an actual team now within prostate cancer designated to the 1 in 4, especially the black community focused initiatives within prostate cancer. It's grown from strength to strength, and the awareness now is, as you can see now, in terms of like highly media coverage, and it's been good to be a part of that journey.
So, so if it wasn't for that conversation that you had with your dad, it probably would have led to something more serious.
Correct.
When you was having that conversation with your dad, what was that conversation like?
Yeah, as most men talk to each other, it's quite ignorant in terms of, you know, that can't be me, and where you get them statistics from.
Yeah.
A Babylon thing that.
Yeah. Yeah.
And then, and then when we reason on a level, we say, what, we no say like you got an education and we know you're on university and you know your thing, and
Yeah.
you know both sides of the water, as one would say. This is I'm talking to me now. He said, no, you should say my son and you look about in terms of my best interest. Let me just take heed and
Right.
see what going what you're talking about, and then let me go up on a journey with you.
Yeah.
And then because like he opened up on that level, he trust me. Yeah, we took the first step together with it, and then yeah, the rest is history, King.
So before the experience with your dad, was prostate cancer ever a thing for you?
No, no word of a lie. No.
So it's like prostate cancer opened up something in your head, in other
Fu-
words.
Fully.
So basically, prostate cancer, because I've only learned about them when I had the interview with um, Alfred.
Mm.
Yeah, I've never, well, probably before that, when I went to an event, I've learned about Prostate Cancer UK. And I realized there's a big movement between them. And they're, advocating, for men. But the statistic, one in
Mm.
four men, what does that
Mm.
mean for you? No, as a black man.
It, to be honest, it's a serious problem to an extent that if you're not dealing with it and we don't get on top of it,
Mm-hmm.
it can become an epidemic within the culture. Simple
Right,
things.
right.
And another thing is that we might be just looking at reasons for death in terms of you just die because we have diabetes, which we're most aware of in other culture.
Mm-hmm.
You have sickle cell as well, depending on which region and activity in terms of whether you're African or Caribbean, again, how that impacts the culture.
Mm-hmm.
But this topic of prostate cancer was not a thing that men talk about because, as you know, men just don't talk about health in general. We don't even go
Right.
hospital too strong.
There's a stigma in the black community, especially in Jamaica,
Mm.
because the traditional test is finger up the bum,
Oh, yeah.
and men do not want to go that way.
Mm.
So, what would be your advice to men about getting tested?
Yes, so this is a really good question, and a question that come up every time when I speak to everybody. So I first start off with, as you say, mentioning the statistics in terms of 1 in 8 for general men in general, just so you know the number.
Mm-hmm.
And then just making sure you hit them really with like that 1 in 8 now impacts us 1 in 4. So they go,
Mm-hmm.
what do you mean by 1 in 4? So for every 1 in 4 black men you see around you, there's a chances that they have prostate cancer or likely to have it. So
Right,
we can start to register that in like a physical sense.
right.
And then from that point, then I then say like, yeah, what's your initial kind of feelings or ideas or what you're aware of prostate cancer? Because I need
Mm-hmm.
to just assess where they are with their knowledge and awareness.
Mm-hmm.
And then once they kind of come to me, as you said, if they come back to me with your initial point, which you said, because the other point, they would already know the right things to do. But if they've got the mindset where they've kind of said, like, physically, I have to, go through them examinations, I don't
Right,
feel comfortable with that because of X, Y, Z. I say, no, the first thing to do now, which is we're in a very good environment or situation, is that Prostate Cancer UK has created this risk checker.
right.
And what the risk checker just generally does is just gives you the opportunity to do your own self-diagnosis of terms of if there are any symptoms that you're giving off that you might feel there's a reason to do a check in the first place.
Mm-hmm.
9 times out of 10 is that I say that regardless of whatever that checker tell you,
Mm-hmm.
still go and do the test. Now they say, what kind of test can I do after this? Then I recommend the blood test, which is the
Right.
initial thing. Now, the reason why I say blood test is the best way to do is because it's just to give you a snapshot of where you are in the process of if you do have a prostate cancer um, reason to check or to do any further checks, if that makes sense. And so, yeah, I'll just say initially, yeah, just go in and do the blood test to kind of keep it nice and short.
So the risk checker, because
Mm,
I think I've done the risk checker before, but
mm.
you're probably more familiar with the risk checker. How do we go about getting the risk checker? Risk
So,
checker.
oh, no, okay. So I say initially just to visit the Prostate Cancer UK website.
Mm-hmm.
If you can't do it that way because it's a bit too much to get around in navigation, but it is quite easy to navigate. But I'll just say, just go on Google, type in prostate cancer risk checker,
Mm-hmm.
and then soon as whatever comes up in the first line, if it's linked to Prostate Cancer UK, click on that link, and it'll just take you straight directly to that. And
Okay.
if you can't get through it on that sense, then what I can do is I can send you a link for this podcast,
Mm-hmm.
and we can also share it that way as well, just to make it a bit more
Yeah,
easier for
I
everybody.
definitely if I tell you I have this thing that Alfred create for me, this app, can't remember the name, but it has prostate cancer link as well, but
So like a link tree.
yeah, like a link tree. Yeah.
Mm,
Um sometimes I remember like topics like this I would normally put it in
mm.
um my description and stuff for it. Um when you heard about the the 1 in 4, what are
Mm.
some of the thoughts that was running through your head at that time?
Me personally, I was like, am I the actual 1 in 4?
Yeah.
Is there a cure for this?
Mm-hmm.
How do I speak to other men about this if I have it? How can I even prevent it from happening?
Yeah. Do you aware of any, apart from your dad,
Mm.
do you aware of any prostate cancer cases in your family?
Yeah, I have a uncle that passed away and granddad that we later figured out that they also had, yeah, prostate cancer.
Same on my side. My granddad passed away from it. Um, and I had a uncle that had it, but I think his death was caused by a hernia, and two of his brother had it as well. Luckily, they got it early. And speaking about early, do you think like early detection and research play a good role in us as men?
Yeah, I think it's definitely very important, but I think it again is one part of the solution. I think education and awareness is even more important for us as a people
Hmm.
initially, because it's also promoting the right attitude and mindset to even approach this in general, if that makes sense.
Yeah.
Because some man don't know, especially like what's the actual age you start off from doing checks,
Hmm.
which we and you would know is 45. But I would say for black men, especially me at the time. So when I was speaking to my dad when this first discussion happened, I was quite earlier in age, so I was in my late 30s. But then later, when I got to 40 and I spoke to my GP and I said, can I have this? When is the earliest without having to wait till 45? You can do this test if it's even possible. And
Hmm.
then they said to me at 40. Now, I think personally, for someone that's in the highly risk group, which is what we are, we should start at 40 as black men, just to just get in the routine of doing it, what I call the yearly MOT. So
Right.
you're familiar with doing your checks. And when
Right.
I speak to a lot of nurses, most of them tell me that if you can educate a person to get used to a routine like that, then this is where you're moving into the territory of prevention over cure,
Right.
because you're starting on this very early. You're not
Right.
working on it until you have the problem, then you have to deal with it.
Right.
You see me?
Yeah, it's like a car, and I'm gonna use CV joint as an example. CV joint is something that in most cars you are aware of it while it's popping up. Of over time, it's wear and tear. It start making noise, but you know that eventually, if you don't fix it, the wheel's going to pop off. So it's best to you to fix that CV joint before. It's something like that when it comes to prevention and cure. It's better to prevent something than trying to cure it, because you might not be into the statistics of, say, your life will be spared. It could be worse for you. I just learned just now that when I'm an uncle, I'm not sure what cancer he has, but I just learned that he's in the hospital now with cancer, and it
bless.
looks serious on him. So it's just before the podcast start, so after we come off the podcast, I'm going to try find out some more information.
Please
But
do.
he's in the hospital now. He's vomiting. He's crying for belly pain, stuff like that. My experience with cancer doesn't look good, but I'm just hoping for the best, you know. But when you look on the statistics of cancer and the prediction of the hike, according to statistics, cancer going to heighten within triple times. What are your thoughts on that?
Yeah, it's. I think at the moment, if we're talking across the board for the 1 in 8, I believe it or not, I think it's slowly improving, but there's a long way to go. And I don't know if you heard about the recent prostate cancer, I forgot what you call it, but where they were lobbying in Parliament recently to have earlier diagnosis treatments, especially
Right.
for the one in
I've seen
4.
that. Yeah, I've seen that.
Yeah, and this is what ties into what you're saying in terms of statistics. It's like until we have an agreed mutual plan across the NHS where they can adopt this, then it ensures consistency across the board, King. Because let me just drop these statistics on you as well. I get most of these from Prostate Cancer UK. But again, regarding the dates and times, for this purpose of call, nobody quote me as perfect. I'm just giving you
Right.
just from the last time I checked it, which was
Right.
about 2 years or a year ago. But they said about 63,000 men are diagnosed every year in general, just to give you some numbers and the audience that are listening to us. But then they say 10,000 men are diagnosed too late.
Too late.
Just so we understand, and this can relate to now what you're just mentioning about the current incident regarding the relative. You see me? And then they say as well that 12,000 men die each year from this. For me, that's too much, if
I
that makes
agree.
sense.
I
And
agree.
and you can imagine within that 12,000 that die each year, we're trying to understand that if the 1 in 8 is saying half of that, I don't think it would be half. I'd say because you got to factor in the 1 in 4, which is double that.
Right.
So how much of us in that population is dying more than the average man? You see me?
Yeah.
And then you see like the numbers, and this is across like the whole UK population of men. So it's a big number, King.
For real. For real.
You see, when we're trying to, as you said, at the Ike, when you look at it from that perspective, and this is
Yeah.
why I say, like, as much as I know we're doing a lot of work to understand the causes, they don't even know realistically, if I'm being honest with you, in terms of why black men in general get this particular severe reaction to the disease than other men in other cultures. So there's still a lot of work to be done there. But at least if we know the basics for where I come from, as I said, in terms of like, it also ties in, and I might dwell off a topic, but you can bring me back. But I always say to everybody about, it's understanding like your mind, your mind, your willfulness in your mind as well, because stress and things have a significant impact on this.
Definitely.
And then also like when it comes to your health as well, like your fitness
Right.
and your dietary requirements and
Diet.
how
Right.
you eat, you see me?
Right.
Like these all have an impact. And I think if they're all managed unwell, like he was referring back to the car analogy, I think it's bound to continue to be a problem. Like you can't just go to the gym and work out, and then when you leave the gym, you start eat takeaway food. It's not working.
That make no sense. Defeat the purpose.
You see me?
Defeat the purpose. For real.
All right.
I remember when I first got my PSA test.
Wicked.
When I phoned up the GP never wanted to give it. And this is where educating yourself is important. because how I found out about the PSA test, when I lost my mom, I start taking my health seriously, because if my mother passed from cancer, and they said men who their mom passed from breast cancer are likely to develop prostate cancer. So I
Correct.
start looking into researches and stuff, and I came across the PSA test. And I said, you know what, let me call up my GP and book a test. When I
Mm.
called them up, they said to me, I'm too young. I'm
Mm.
41. I'm too young. And I was
Mm.
like, what you mean too young? Like, my mom passed from breast cancer, so I'm at high risk and I need to know what my prostate is like. And it's
Mm.
like, okay, come in for a test. So with that thing where I think the NHS need to look into that, as you said, it was in Parliament. I think they
Mm.
need to look into that, because the statistics of men being diagnosed of prostate cancer is gone way beyond. It can even be less. People can diagnose, because I've seen female that's been diagnosed with breast cancer at the age of 25.
Mm.
Prior to that, they used to said it's 55 and over.
Mm. True.
Personally, I've never heard about anybody, any male had prostate cancer before 45.
Mm.
I'm not certain. I've never looked into any, I've never seen any of that in my research as yet. But I realized that cancer in this time and age is not about age anymore.
No.
So I think that shift in the NHS need to, look into, instead of refusing people, instead of refusing men to do a prostate cancer check. I know it's expensive, right? So it may put a burden on the NHS. But before you just turn them away, find out, why do you want the test?
Mm.
Because they never asked me that. They just
Mm.
turned me away right away. If I never had the education about prostate cancer, I would have said, okay, then I'll come back when I'm 45.
Mm-hmm.
So instead of you turning away a man, especially black men,
Mm.
find out from them, why do you want to do the test?
Mm.
And hear what they're saying, and then you can analyze from there if it's necessary for you to do the test. So that's what I think is thing. Um your dad, going back to
Mm.
your dad. Um
Mm.
I know
Can
you
I add to
mentioned,
your point as well?
pardon?
Before, can you save what you're gonna say? Can I add to that point about, because I think this is a
Yeah,
very important topic
yeah,
you
carry
mentioned here.
on. Carry on.
Yes. No, so I want to say thank you, and I hope everybody's listening to you when you said what you mentioned just now, because it's a very important part of the process when you said about what was your experience when you had the PSA test and your
Mm-hmm.
first entry in, like, it's not just you did the PSA test, now you find out you have a potential reason to go down there, and then now you're engaging with the surgery itself.
Mm-hmm.
This is very important because I'm also doing a little bit of research on this particular topic, which is about not just identifying whether you have it and then the diagnosis after that,
Mm-hmm.
or even the aftercare of, like, once you have gone through the whole process, how you treat after that
Mm-hmm.
is the point of entry. And you're right, it comes down to the communication, the education, and also just the understanding, as you said, in the why before you make a decision to the
Mm-hmm.
patient that's requesting the initial, because there's a lot of internal barriers before you even want to go to the practice, because
Right.
you don't know what's going on, you don't know what to do next,
Mm-hmm.
you only know just a little bit of information, and you just want to know as much support on a very sensitive journey you're about to take.
Definitely.
And that's outside of maybe even involving your own family, if that's the
Right.
way you wanted to approach that.
Right.
So I think you, as you quite rightly said, it's very important for a lot of general practices to really, and this comes down to even down to the reception,
Mm-hmm.
to be able
There
to
you
actually
go.
to take in the communication skills, to to listen to the patient, understand, especially when it hits these risk groups, high risk groups, which you're mentioning, which is
Mm-hmm.
you clearly the 1 in 4 if you're got a family history, and then
Mm-hmm.
whether your mother's had breast cancer or some kind of cancer in her family generation lifetime,
Right.
because obviously it has a more significant impact on the cancer itself if you're male. So again, it's they need to, you're right, have a better communication and understand, just so they're not an additional barrier in going through the process,
Mm-hmm.
if that makes sense.
That makes
So I just wanted to
total
just add
sense.
to what you're saying, because I think that's a very important part, and you're right. That's what we need to work on. I think that's what I'm trying to work on at the moment, is just to review the process, because I had a personal experience. So I usually do my PSA test every year as well.
Mm-hmm.
And there was some confusion with one of the results that I had received, meaning that there was an anomaly. And they said I needed to take an extra blood test.
Mm-hmm.
And what that blood test meant is that it knocked out the initial date that I usually do the blood test once a year.
Mm-hmm.
Meaning that, so when I went to do my blood tests again after the second instance, so I've had one, then I had two, and then I went to do my normal one because the results that came from the second test were fine. So
Right.
I thought, oh, let me just continue doing the 1 year like I normally do. When I came to the 1 year, I the nurse at the time said to me, "You can't do this because you've already had one earlier than you're supposed to."
Mm-hmm.
I said, "That's not really the reason why I'm here. I'm just here to make sure I'm still doing that yearly interval." So she
Definitely.
took into consideration, because you already done the second test, you gotta wait now to the following year. My only concern with that, as you could know as black men, is that, say for instance something happens within that extra time frame, I've had to wait a little bit longer to then do the test another year. If that makes
Yeah.
sense. There's a lot that can happen with the body. So
It
it's
could
just
be
like
too
these simple,
late.
you see me?
Right.
That's the point I was trying to make. And I think when I was explaining that to the nurse at the time, she just was not having none of it. She just said, "That's just the way it is. And I've spoken to somebody, and this is the decision that I'm making, and that's final." And I was just like, so say if I was someone that was like less kind of understanding of the process,
Mm-hmm.
I may just give up and say, "You know what, me can't bother with this."
Definitely.
Let me be honest
That's
with
what would
them.
happen. That's what would happen. You just leave it alone.
You see me? And this is why I added a point where, just to give people hopefully a little bit of understanding, that if you are going through these experiences that you've mentioned and I've mentioned just now, still be persistent, and still make sure you can stay consistent with still continuing the checks. If they do give you some nonsense and say you have to wait till next year, if it does and it is that situation, then just wait till the next year. But just make
Right.
sure you keep doing it, is my point. Like, don't just feel discouraged because they didn't do it, if that makes sense. Just make sure
Definitely.
you just still work on your health and your mindset and all of them things you're supposed to, and then just wait till your next test, if that makes sense.
Definitely.
And then
I'm
bring it
going
up to GP.
I'm going to add to that. The next thing I've noticed with the NHS, and I want people to understand that the NHS is not your health. You have to take your health into your hands. You have to advocate for yourself. So, the NHS as their screening program for diabetes or whatever, would they call you and do your blood test. Um, I think, and I think this is what probably be discussing in Parliament as well, based on my understanding. That screening where they would directly call you, just like they would call female to do their mammogram. I think that should be in place where they call you to do your screening, because I started my prostate journey in 2022, and I have to be the one who call them and say, "Listen, I've done a prostate test last year this time. Can I repeat the process, please?" You know, and I remember last year I didn't call them at that time, and I was wondering, like, I never remember what date it was until probably about 3-4 months after it came to my head. I'm like, oh, my prostate test. And I end up calling them. Now I'm thinking, like, why they haven't called me knowing that I have a pattern? You know what I mean? So if we are not advocating for ourselves, then we can miss that important test that could save our lives. you know. So don't wait on the NHS to call you to say, come do your prostate, because that is not a protocol for them. Check it for yourself. Call them. Let me have it. You know what I mean? And if you're feeling any symptoms and they do not want to do it, and you know that symptoms align with prostate cancer, try get it private, because your health depending on it. I know it's expensive, but better you spend a few penny on a test than spend dollars and trying to be cured, you know. So that is something important as well. But regarding to symptoms, as about your father, I
Mm,
know you mentioned that you were the one who introduced the test to him,
mm,
but he was at stage one,
mm-hmm,
looking to pass over to stage two.
mm.
Wasn't there any form of symptoms in his head?
Yeah, now a good question again. So they say at the first stage of prostate cancer, there was hardly any symptoms.
Mm-hmm.
When I say that, in terms of like the only light symptoms you might really receive is that either you're going to toilet quite a lot in terms of going to wee,
Mm-hmm.
like holding your bladder, possibly like stomach abdominal pains and things like this.
Mm-hmm.
So they, because it's so generic, it's not big enough to say I have a problem like with that, with the back passage or something like that. There's not really showing any kind of extreme pains or strenuous or fatigue or tiredness, if that makes sense. It's
Right.
just no, he just had normal day to day, which he'd probably align more with work than he would say is a personal issue regarding the body,
Mm-hmm.
if that makes sense. So that's
Yeah.
why it was hard to find out at the time. So we just did it based on information and curiosity. Let's just pursue to see if it's a possibility that you might have it, but you just don't know it's there.
Mm-hmm. Understood.
And yeah, that's what kind of led us to to go down that journey.
Has he been advocating amongst his peer and what it is like for him to be advocating for prostate cancer? Has he been being received?
Yeah, this is again, if I'm being honest with you, it's mandatory because like when you get to this stage now where you become aware, you
Mm-hmm.
become a steward,
Right.
and
You fall
and
in the
so
camp.
how you mean the big time mascot? No.
Right.
So when man like me and you and everybody involved in all this situation, it's more or less just coming together, sharing knowledge and information, making sure as well it's come from the correct sources as well. So you're not just promoting propaganda and nonsense in the community, but when we're kind of fact checking what we're talking about as we do, and then also at the same time just share your personal experience in terms of, because we'll go more into the detail in terms of whether he has to do certain treatments or certain surgeries, like again like the physical examination. I'll be direct and honest on this call just so it gives a bit of transparency so people know what really this involves and how far we and you go in this process, but especially me, is that I have gone through the rectal examination.
Mhm.
And yeah, of course, I had all of the thoughts and feelings from my previous upbringing in terms of how men, especially within the culture, move, and that's not something that we do.
Right.
But when I realized that, as you said about the cost of if you don't invest in your health now,
Mm-hmm.
the price of the pain that you'll pay later will be even more costly.
Definitely.
So, once I just kind of committed to that process and, I was explaining how it would go, and the doctor was fully aware of like how I feel personally.
Mm-hmm.
It just walked me through the process, and then I did it. And then, once you kind of did it once, it's not something you have to do all the time.
Mm-hmm.
And it's in the context of why you're doing it is the most important thing, I think, which kind of registered with me because
Right.
I'm doing it for health and just to make sure I can live longer for the family.
Definitely.
So, and then, yeah, then I just went through it. It was a bit discomforting at the first instances, and I can't lie, I was a bit afraid of it, bit anxiety and all kind of things that you would normally experience with with such a thing happening. But yeah, once I had done it, I understood the purpose of it, explained to me like what they were looking for and etc. I said, oh, okay, it's not as bad as I thought it would be, other than just the discomfort.
Right.
And then I realized that it's not something again you have to regularly do. You just do it on certain instances where if you're going through a point of self-management, which you said in terms of the blood test,
Mm-hmm.
but then there is a potential that from the blood test it might show there's anomalies of growth for whatever reason,
Mm-hmm.
then they just do that initial double check to just make sure if there is actual growth,
Right.
because you want to make sure that if you do that, that's better than you saying you want to go for an MRI scan and all these other things, because there's the impact of radiation when that licks your body, and then the side effects of that experience.
No, we don't really want to go there, so.
You see me? Yeah, you see me.
Really,
So
so
just
better you just do what you
yeah,
have to
so
do
do
from now.
all right. So that's the point where I make that is that if you can do anything that's having to step away from that process, you're in good stead, man, to just make sure you can prolong your life.
In my research, I found out that chemotherapy
Mm,
is carcinogenic,
you see me?
and
Correct.
it puzzled my mind. But that is another topic for another day. You know what I mean?
Ah,
It's
true.
just puzzling to my mind, and I think people need to look into that. And I'm going to repeat it. Chemotherapy is carcinogenic. It's a carcinogen, so people need to look into that. You start a movement.
Mm.
Where do you see that movement few years from now?
Hopefully, that is so talked about naturally, like a conversation. You just say, "How was your day?"
Right.
Meaning that a man can just talk to an next man and say, "We're not being, how can I say, fixed mindset." Where, as you said in the beginning of this entire conversation, that it's just a finger up your bum and you get violated and all them
Mm-hmm.
stupidness there.
Mm-hmm.
No, you're able to understand like there's a reason in terms of a purpose. There's a why behind it, and
Yeah.
then how it impacts you and what you're really doing to make sure you're in a better place. So yeah, where I would really like to see it is just becoming a common conversation with no barriers, regardless of your culture or background, and not seeing it as just a us and them situation, meaning that we're one in four, so we have to worry about us more than the rest of them. No, we're all men, we're all on the same journey. It's impacting everybody, regardless of whatever background you're from. And I
Mm-hmm.
think it's just coming together to just support each other as men to just have a serious conversation and say, as you said, just get yourself checked out.
You think community should play a part in prostate or cancer awareness? How important it is that the community get together?
Very important. And this is across not just black men, but I think the queens and the empresses of them in the community. When I say the
Definitely.
queens and the empresses, I mean the women in the
Right.
community for people outside the car that don't understand the culture.
Yeah.
But yeah, it's making sure that the women can also speak to their husband, then brother, then father, grandfather, father-in-law, whoever, and also say, I understand.
Mm-hmm.
And just like I do my tests, this is a test that you need to do, and we can support each other along the journey. You're not alone.
For real. What would you say to men who feel fine and think testing isn't necessary? Just like into your father case earlier.
We say bond the ignorance, man, and just get
Yeah,
yourself checked out, man. Stop that foolishness. Well, I
yeah.
mean, it's not only our old man mentality, but I'd say it's a prehistoric mentality, man. We as you know, with the technology, we move on in our life, so you have to
Move on.
adapt. You have to
Yeah,
adapt to times, man, and you have to
definitely.
just do things that's just consciously right.
Definitely. Definitely. If a black man is in his 40s or 50s, is listening right now and
Mm.
feels scared or hesitant, what message would you want to leave with him?
Oh, wait, there, can you rephrase that again? Sorry. Okay.
If a black man is in his 40s or 50s,
Mm,
listening to this podcast right now and
mm.
feels scared or hesitant, what advice would you give to him?
I'll say to him, it's okay to not be okay initially, and just get yourself checked out and trust the process more intentionally. Make sure if you can, because I know sometimes it's a bit of an overwhelming experience.
Mm-hmm.
Speak to somebody in the family about it,
Yeah.
just so they know and they're aware of how you're thinking and feeling. And then once that's kind of out the window, just engage straight with the health authorities in terms of the GP surgery, and then just get yourself checked out. And you got options as well. If you're really feeling like before even we want to engage with the hospital, the general practice, you can speak to people like Prostate Cancer UK, and they've got a lot of like helplines and things that they can help with regarding the nurses, and they can just explain to you what the whole process would entail from start to finish if it was to escalate at any point and what stages you're at. So then there's a lot of additional resources now that are available that weren't available in my time.
Definitely, because I think that's where the stigmas be coming from back in our time. People know about one thing, you know, and that's where the mind is at. They are not aware of the 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 evaluation of testing. Testing is evolved right now. There's so many ways to test apart from the tradition. You know, as one person would say that it is more effective. Doing the blood test is a start. You
Mm.
know, um, is there anything that we should have covered that you probably want to volunteer that we may not have?
Yeah, the only thing I'll just say is that, which I'm sure you do and I'm doing at the moment, but it's just to live by what you say.
Mm-hmm.
Meaning that if you're saying that you are going to share information, share your own experience just so you can advocate that you've gone through a journey they're about to go through.
Mm-hmm.
Just to help people sell themselves.
Right.
And then initially, like I think a very important point you made at the beginning again, which or midway through our conversation was the importance of investing in your health now than waiting till later.
Mm-hmm. Very
Don't
important.
don't wait until the problem has arisen to start working on it. And then my last departing point is that, and I think this is maybe unorthodox and outside the process, but I feel that, as I said before, the mindfulness in terms of the way you manage your mind,
Mm-hmm.
your attitude towards this
Mm-hmm.
is very important. And also, like your fitness and your diet is very important as well. Because I believe personally that, and it might not be on record, but I've just been analyzing this process where I said, when you get to a certain age of like 40, your body just naturally slows down. So your prostate is always going to be in your body. It's always been there because that's what produces your sperm, if you're not aware of that.
Right.
But your testosterone, in terms of like once you do a lot of these checks and take this medication, will reduce. So it's important that if you are maintaining a certain level of fitness, you
Mm-hmm.
can naturally just keep your testosterone at a certain level, which is healthy. So my point I'm trying to make to this is that I think when you're maintaining a healthy fitness and lifestyle in terms of your food and nutrition, it counter reacts or counterproducts the growth of like the maybe these diseases like feeding off your body naturally, if that
Mm-hmm.
makes sense. So I think
Yeah.
the higher metabolism and things like that are, it kind of works against maybe these viruses growing maybe at a rate that's more aggressive than they normally would, is my thing. But it's just between us and just maybe sharing as a bit of personal recommendations for myself. So my thing is, yeah, just working on your mind, yeah, your fitness and your nutrition.
I agree. Jay, I really appreciate you passing through and sharing these insights to our listeners. We have a closing tradition where the guest would leave an encouraging word for the next guest coming up. And the person that I've left the word, encouraging word for you, goes by the name of Jody Brown. And she said, your job today is not about defeating the storm of life, but looking for a break in the clouds where the light can escape. Through it all, remember, the sun still shines and it will break through again to strengthen your soul. Good word of
Wow.
encouragement.
Wow.
Jay, big respect.